Good day, everyone. Today's lecture will be on emergency drug use in dentistry. This lecture will cover the need for emergency kit in dental clinic, the types of emergency drugs that should be available on the emergency trolley, the dosage, indication and contraindication of these drugs, the antidotes for these drugs, and the necessary emergency equipment that should be available. Medical emergency in dental practice are rare situations, but they are of great concern. Dental professionals should realize that medical emergencies can do and will happen during the course of practice. These emergencies could be related to dental treatment, patient risk factors, or they could occur unexpectedly in the dental environment. A medical emergency could evolve into a life-threatening emergency if it goes without proper treatment. It is for this reason emergency medication should be present in dental office. The best way to avoid a medical emergency in dental practice is by careful assessment of the patient. This includes a detailed medical and medication history. It is important to remember that all dental personnel have a professional obligation to ensure that they are properly trained and are up to date with emergency management. And it is also important to remember that a failed attempt at resuscitation is always better than failing to attempt resuscitation. What is the purpose of having emergency kit or emergency trolley? The purpose is to sustain life and to stabilize and prevent medical urgency from becoming medical emergency. So emergency trolley should be simple but effective. The Resuscitation Council of United Kingdom published a list of recommended equipment which includes both drugs and equipment. It is recommended that to accommodate the most common types of medical emergencies encountered in general dental practice, the emergency trolley should include pharmacological agents and airway accessories. Pharmacological agents should include adrenaline, antihistamine, for example, diphenhydramine or chlorpheniramine maleate, anticonvulsant, for example, diazepam, midazolam, or lorazepam, antihypoglycemic, dextrose, glucagon, or glucose, analgesic, for example, morphine, and other pharmacological agents such as lignocaine, atropine, and salbutamol inhaler. Airway accessories should include oxygen concentrator, oropharyngeal and nasopharyngeal airway set, nasal cannula, face mask, and ambu bag. This is examples of emergency trolley. An emergency trolley should have multiple story rack or drawer, and the topmost drawer should be reserved for the placement of emergency drugs. The emergency trolley also should have a stand for IV line or IV maintenance, a place for oxygen tank, and a compartment for ECG machine and automated external defibrillator. This is just to show the oropharyngeal airway instrument. We have oropharyngeal tube and endotracheal tube with laryngoscope. These are important instrumentation to maintain the patency of the airway. We also have ambu bag and face mask and also the oxygen tank. Other accessories should include automated external defibrillator, glucometer, and also stethoscopes. There are few important rules that should guide us when using emergency drugs. The first rule is that the dental professional and the team should be well versed and familiar with the dosage and the action of all these emergency drugs. Second rule, they should know the location of the emergency drug kit or trolley in the clinic. Third important rule is that an emergency drug logbook should be available and the drug need to be reviewed each month. The fourth rule is never give an expired drug. And the last important rule is the dental professional and the team should know how to administer each emergency drug. As mentioned before, medical emergencies can happen in dental office and we must be ready to react and respond. Here is an acronym that can be used to assist us in trying to remember the many emergencies along with the emergency drugs that could be potentially be used to treat them. CANAL acronym stands for cardiac, airway, neurological, allergic and drug reaction, and loss of consciousness. These are examples of medical emergencies of cardiac origin. We have chest pain, myocardial infarction, dysrhythmias, sudden cardiac arrest, and ventricular fibrillation. Pharmacological agent that can be used for chest pain are oxygen and nitroglycerin. For myocardial infarct, we can prepare oxygen and aspirin. For dysrhythmias, we can utilize advanced cardiac life support drugs, for example, adenosine, amiodarone, atropine, dopamine, lidocaine, and magnesium sulfate. For sudden cardiac arrest, initial treatment should start with the use of automated external defibrillator. And for ventricular fibrillation, we can utilize the advanced cardiac life support drugs. Medical emergencies of airway origin. Example, foreign body obstruction, bronchospasm, and laryngospasm. For foreign body obstruction, we should utilize the airway techniques to dislodge the obstructed foreign bodies. For bronchospasm, the pharmacological agent that can be used are albuterol, oxygen, and adrenaline. For laryngospasm, we can use oxygen and succinylcholine. For medical emergencies of neurological origin, for example, seizures, panic attack, and anxieties. So the pharmacological agent that can be used for seizures are anticonvulsant drug. For panic attack and anxiety, we can use anti-anxiety drug. Medical emergency related to allergic and drug reaction, for example, latex allergy, anaphylactic shock, allergic reaction, benzodiazepine overdose, local anesthetic overdose, and narcotic overdose. Pharmacological agent that can be used for latex allergy is diphenhydramine. For anaphylactic shock or anaphylactic reaction, we can use adrenaline, diphenhydramine, albuterol, and dexamethasone. For allergic reaction, we can prepare diphenhydramine. For benzodiazepine overdose, we can use flumazenol. And for narcotic overdose, we can use Narcan. For loss of consciousness, example due to syncope, sudden cardiac arrest, or hypoglycemia. Pharmacological agent that can be used to treat syncope, for example, ammonia inhalant. For hypoglycemia, we can use glucose. For sudden cardiac arrest, the initial management still to utilize automated external defibrillator. So as a general rule, adrenaline can be used for anaphylaxis and bronchospasm. Diphenhydramine can be used for allergic reaction and anaphylaxis. Albuterol can be used for asthmatic attack and bronchospasm. Nitroglycerin can be used for angina. Aspirin can be used for suspected myocardial infarct. Glucose source can be used for diabetic emergency, for example, in hypoglycemic. Midazolam or diazepam can be used for seizure. Ammonia inhalants can be used for syncope, and oxygen can be used as supplemental adjunct. Now let us look at a number of pharmacological agents that can be placed on the emergency trolley. First is what we call albuterol. Albuterol is a bronchodilator. It stimulates beta-2-adrenergic receptor, which can cause bronchodilation. Albuterol is indicated for the treatment of bronchospasm. The dosage is 1 to 2 puff per dose. There is no contraindication to use albuterol in acute episode of bronchospasm. Suggested stock for our emergency trolley is 1 albuterol metered dose inhaler. Albuterol may have a certain degree of drug interaction with digoxin, diuretic agent, antidepressant, beta blocker, and monoamine oxidase inhibitor. Albuterol overdose sign and symptom may include dry mouth, tremor, chest pain, fast or irregular heartbeat, nausea, general ill feeling, seizure, feeling lightheaded or fainting. And the treatment of albuterol overdose is based on the symptom. For example, we can use propranolol in the case of tachycardia. We can use charcoal in the initial management of albuterol overdose, and we can correct the electrolyte or do a electrolyte replacement in the case of hypokalemia. The second pharmacological agent is aspirin. Aspirin is an antiplatelet which inhibit prostaglandin synthesis and inhibit platelet aggregation irreversibly. So aspirin is indicated when there is suspected myocardial infarct. The dosage is 325 mg non-enteric coated aspirin tablet chewed and swallowed, or 481 mg chewable tablets chewed and swallowed. Aspirin should not be given to a person who are allergic to it or have active gastrointestinal bleeding. So the suggested stock for our emergency trolley, we can place 1 or 2 packets of chewable 325 mg non-enteric coated aspirin or 481 mg chewable tablet. Aspirin has a number of drug interactions. A combination of aspirin with other NSAIDs can increase the risk of stomach bleeding. And a combination of aspirin and selective serotonin reuptake inhibitors or other antidepressants can also cause an increase in the risk of bleeding. A combination of aspirin and warfarin can reduce the drug's anticoagulant effect and increase the risk of bleeding. A combination of aspirin and methotrexate can result in a poor excretion of the drug. This can lead to increased level of methotrexate in the body and can cause poisoning of the methotrexate poisoning. There is no specific antidote for aspirin or salicylate poisoning. Therapy is focused on immediate resuscitation, correction of volume depletion and metabolic derangement, gastrointestinal tract decontamination, and reduction of the body's salicylate level. Initial treatment of aspirin poisoning or overdose should include the use of oral activated charcoal, especially if the patient presents within 1 hour of injection. The third pharmacological agent is diphenhydramine. Diphenhydramine is an antihistamine which antagonizes histamine at the H1 receptor and causes sedation and has an anticholinergic effect. Diphenhydramine is indicated in allergic reaction or anaphylactic reaction. The dose is IM or IV 50 mg. There is no contraindication to give diphenhydramine during an allergic reaction unless noted allergy or hypersensitivity to the diphenhydramine. Suggested stock for the emergency trolley, it can either be 2 1-ml ampoules or vials of diphenhydramine 50 mg per ml or diphenhydramine hydrochloride capsule 25 mg. Treatment for diphenhydramine overdose include management of the sign and symptom and the use of activated charcoal at the initial stage. The next pharmacological agent is adrenaline. Adrenaline is a cardiac stimulant. It activates alpha and beta adrenergic receptors, which cause increase in the heart rate, myocardial contractility, bronchial dilation, and decrease peripheral vascular resistance. And adrenaline is indicated in anaphylactic reaction and also bronchospasm. The dosage is IM 0.3 mg every 5 minutes. There is no contraindication to give adrenaline during anaphylaxis. Suggested stock for emergency trolley, it can either be in the form of 2 auto-injectors of adrenaline in adult form and pediatric form, or 2 1-ml ampoules or vials of adrenaline 1 in 1,000. The mechanism of action, adrenaline acts on both alpha and beta adrenergic receptors. The mechanism of the rise in blood pressure is threefold. It involves a direct myocardial stimulation that increases the strength of ventricular contraction, positive inotropic action. It also results in an increased heart rate, which is positive chronotropic action, and it causes a peripheral vasoconstriction. So all this will result in the rise of blood pressure. Adrenaline has a certain degree of drug interaction. Drugs such as alpha blockers, vasodilators, diuretics, and antihypertensive drugs can antagonize pressure effect of adrenaline. Drugs such as sympathomimetics, beta blockers, tricyclic antidepressant, monoamine oxidase inhibitor, on the other hand, can potentiate pressure effect of adrenaline. The use of beta blockers, antihistamine, thyroid hormones, and diuretic agent can cause potentiating arrhythmogenic effect of the adrenaline. And the use of potassium depleting diuretic agent, corticosteroid, and thiopyline can potentiate hypokalemic effect of the adrenaline. Overdose of adrenaline. This can result in elevation of the arterial pressure, which may result in cerebral vascular hemorrhage. Overdose also may result in pulmonary edema because of peripheral vascular constriction together with cardiac stimulation. Adrenaline is rapidly inactivated in the body, and treatment following overdose with adrenaline is primarily supportive. Treatment of pulmonary edema consists of a rapidly acting alpha adrenergic blocking drug and respiratory support, whereas treatment of arrhythmias consists of administration of a beta adrenergic blocking drug, for example, propranolol. The next pharmacological agent is nitroglycerin. Nitroglycerin is anti-anginal. It is a coronary dilator. It stimulates the cGMP production, which relaxes the vascular smooth muscle, specifically in the coronary arteries, in the presence of an anginal attack. So nitroglycerin is indicated in the treatment of chest pain or angina. The usual dose of nitroglycerin is 1 sublingual 0.4 mg tablet or 1 spray 0.4 mg from nitroglycerin spray atomizer administered every 5 minutes. We have to be very careful when giving nitroglycerin in patients with low blood pressure. Nitroglycerin works by promoting blood flow. The body breaks nitroglycerin down into nitric oxide. Nitric oxide causes the smooth muscle within the blood vessel to relax. This allows vasodilation and improved blood flow. During an angina attack, a person will experience intense chest pain. Nitroglycerin will start working within 1 to 3 minutes, but its maximal effect occurs after 5 minutes. Nitroglycerin is contraindicated in patients with allergic reaction to nitroglycerin. It is also contraindicated in patients with increased intracranial pressure, in patients with severe anemia, and in patients with heart attack. Nitroglycerin has a certain degree of drug interaction. It interacts with the drug which is used to treat erectile dysfunction or pulmonary hypertension, for example, sildenafil or tadalafil. It also interacts with drugs which is used to treat migraine. So the treatment for nitroglycerin overdose include the use of activated charcoal, respiratory support, and medication or drug to treat the sinus symptoms. The next pharmacological agent is midazolam. Midazolam is a short-acting benzodiazepine central nervous system depressant. It is a hypnotic sedative drug with anxiolytic, muscle relaxant, anticonvulsant, sedative, hypnotic, and amnesic properties. The action of midazolam are mediated through the inhibitory of the neurotransmitter gamma-aminobutyric acid, which is GABA, which is one of the major inhibitory neurotransmitter in the central nervous system. Benzodiazepine increase the activity of GABA, thereby producing a sedating effect, relaxing the skeletal muscle, and inducing sleep, anesthesia, and amnesia. The dosage is either IM 5 to 10 mg or intranasal 0.2 mg per kg, or if oral or infiltration or topical can give 5 mg per ml. The onset of duration is between 1 to 2 minutes and the duration of action is 30 to 60 minutes. However, midazolam can cause respiratory depression or hypotension. So the antidote for midazolam is flumazenil. Midazolam is contraindicated in alcohol intoxication, in drug abuse, depression, myasthenia gravis, wide-angle glaucoma, or patient with close-angle glaucoma, and in situation where it's worsening of debilitating chronic lung disease. Midazolam has a certain degree of drug interaction with aspirin, adrenaline, lorazepam, antibiotics like augmentin. It also have drug interaction with diphenhydramine, and also with albuterol, furosemide, and also paracetamol. The next pharmacological agent is ammonia inhalant. This is a respiratory stimulant. It is indicated in the use for syncope, fainting, and loss of consciousness. Dosage 1 to 2 vaporils. Suggested stop for emergency trolley, 1 bulk of ammonia vaporils. Next is glucose. Glucose is anti-hypoglycemic. It increases glucose level for treatment of hypoglycemia. So glucose is indicated for hypoglycemic cases. Dosage 1 tube of glucose gel. Suggested stock for emergency trolleys, we can have like 3 tube of glucose gel installed on the emergency trolley, or 3 tube of glucose tablet. Dextrose or 50% dextrose is an anti-hypoglycemic. It's a source of calories and fluid for patients that are not able to take oral fluids in the event of hypoglycemic reaction. So, and then glucagon is anti-hypoglycemic drugs. It can cause a rise in blood glucose level by promoting hepatic glycogenolysis and gluconeogenesis. Okay, the last pharmacological agent that I want to discuss is oxygen. Oxygen is used in almost any type of medical emergency. The dosage is at least 2 liters per minute for patient. But be careful, do not use for the case of hyperventilation. Suggested stock for our emergency trolley, 1 portable cylinder of oxygen with regulator and the equipment necessary to deliver oxygen to the patient, for example, nasal cannula and ambulance. Alright, this is to summarize the pharmacological agent that's been discussed and other important pharmacological agent. Okay, so oxygen, as mentioned before, indicated for all medical emergency except hyperventilation. The root therapy mask nasal cannula can also give pocket mask, back valve mask. Okay. Adult dose between 2 to 6 liter per minute. For pediatric dose 3 to 5 liter per minute. Adrenaline is indicated for anaphylactic shock. Chlorpheramine, diphenhydramine indicated for cases of mild allergy. Nitroglycerin indicated for angina, root sublingual or spray. Salbutamol or albuterol is indicated for asthmatic or bronchospasm. Root metered aerosol inhaler. Aspirin indicated for myocardial infarct. Can either give sublingual or per oral. Diazepam, midazolam, and lorazepam are indicated for status epilepticus seizure. For morphine sulfate is indicated when angina is unresponsive to nitroglycerin. Dextrose and glucagon for hypoglycemic cases. Hydrocortisone for adrenal crisis or anaphylaxis, dexamethasone as well. Propranolol indicated for cases of hypertension. Atropine for bradycardia. Aromatic ammonia for syncope, this is inhalant baths. Nifedipine can be given for hypertensive patient or angina. Verapamil can be given for hypertension and supraventricular tachycardic cases. Flumazenil can be given for benzodiazepine overdose. Naloxone can be given for opioid overdose. Tranexamic acid can be reserved for post-operative bleeding. Okay, so that is all I want to say about the pharmacological agent or emergency drug that should be available in our dental clinic.